GERD is one of the most common digestive related conditions veterans experience after service. The stress, the anxiety, the physiological changes that come with post traumatic stress disorder, PTSD, can directly impact your digestive system, causing or worsening acid reflux veterans and chronic GERD symptoms over time, right? I'm going to break down in this live stream how the VA rates GERD secondary to PTSD, how to get it service connected, how to file your claim, and why a strong nexus letter and a disability benefits questionnaire may be the key to win your claim. Thank you for tuning in. Like, subscribe, comment, hit that notification bell, and thank you, veterans, for your service. So that's right. We're breaking down how your service connected PTSD can actually cause or aggravate your GERD veterans. Okay. And more importantly, how to prove that service connection so that you can get the benefits that you deserve. Right. So grab your notepad. This episode is packed with gold nuggets that could change your claim. So let's start with the basics. What does GERD stand for? Okay. It's gastroesophageal reflux disease. It's when stomach acid constantly backs up into your esophagus, causing that burning feeling in your chest, acid reflux, heartburn, even pain that can feel like a heart attack sometimes. Now, here's the key question to this. How does PTSD connect to GERD? When you live with PTSD, your body is often in constant fight or flight mode. Many of you probably listening know what I'm talking about. What does that mean? That means that your brain is pumping out stress hormones, cortisol, adrenaline, nonstop, etc. Those hormones increase stomach acid and cause tension in your digestive system. Over time, what ends up happening is that constant stress, maybe that chemical imbalance, can tear your stomach up. What does that lead to? Reflux. It could lead to ulcers, and it could lead to other gut problems. And that, my friends, is how PTSD can cause GERD. So, if you're already service connected for PTSD and your doctor can show your GERD was caused or aggravated by it, that's a secondary service connection. Okay. It's very, very important. Now, what does the VA need to see to approve your secondary claim? There's three main things: a current diagnosis. You've got to have a confirmed diagnosis of GERD from a doctor, an existing service connection, right? An existing service connected condition, in this case, PTSD veterans, and a medical nexus. That's the link between the two. Very important. The nexus letter is what ties your conditions together through medical scientific literature. Veterans, you'll need a unbiased, I say unbiased, medical opinion that says something like it is at least as likely as not that the veteran's GERD is caused or aggravated by their service connected PTSD. That phrase, at least as likely as not, is very critical. It's the VA's standard of proof, meaning it's a 50-50, but it could go either way. It usually should go in your favor. So, very, very important to understand that. How does the VA rate GERD? They rate it secondary to PTSD under diagnostic code 7206 with possible ratings of 0, 10, 30, 50, or 80%. How do you get a higher rating? What's the severity of your GERD? Okay. To prove secondary service connection, you need a current GERD diagnosis from a qualified licensed provider in medical evidence, a nexus, as I was just talking about. You need to show that it was caused or worsened by your service connected PTSD. A strong nexus letter from a qualified healthcare provider can be key to proving GERD secondary to your PTSD. If you need a nexus letter, if you need an unbiased one, right? If you need someone that's going to thoroughly look at the evidence of your claim, reach out to us. We can help you. It is unbiased, untainted. It's very, very important. Right now, the VA is, I've seen decision letters that come back that say this provider was 300 plus miles away. That does not matter, especially if you're secondary in GERD to PTSD. Your provider could be 500 miles away. As long as they're factually looking at all the evidence presented, That's what matters most. Okay. So not all Nexus letters are created equal. So if you are going to get a Nexus letter, make sure the doctor knows the research. Make sure that you guys have a good game plan coming up. Make sure that you know everything that goes in your packet. Even then, when you get it all right, let me tell you something. We just got a veteran today to 100%. The VA screwed it up. It was wrong, right? The decision was clearly wrong. It had to be higher level reviewed. So even though he submitted all the right evidence, everything in his power that he could, even though everything was dressed right, dressed and squared away, the VA still denied him. So it's important. If you do need help, reach out. We are here for you, right? Make sure that you get the help that the help that you need, the help that you deserve. Okay. So according to a 2024 study, veterans may be at increased for GERD due to exposure to toxic substances. So, Gulf War veterans may have been exposed to chemical warfare agents, pesticides, drugs, which can contribute to chronic gastrointestinal or GI problems, right? According to this 2024 study as well, increased intestinal permeability. Studies show veterans with chronic abdominal pain and diarrhea may have leaky gut, leading to more severe GI symptoms, right? There could also be changes in the gut microbiome. So, deployment related infections or stress can alter gut bacteria veterans, increasing the risk of GI disease. Maybe you're dealing with acute enteric infections, okay? Food or waterborne pathogens encountered during maybe your deployment may trigger long term GI gastrointestinal issues, including diarrhea and IBS, also known as irritable bowel syndrome. Maybe chronic stress, service related, right? Psychological stress, including post traumatic stress disorder, can worsen digestive function and increase acid reflux. Medication side effects as well. Common medications such as non-steroidal anti-inflammatory drugs or PTSD treatments can irritate the digestive system, veterans, and contribute maybe to your GERD. So what is the link between GERD and PTSD? When you live with PTSD, as I mentioned earlier, constant stress, anxiety, and tension, what does that do to your body? It can cause your body to produce excess stomach acid, leading to acid reflux or GERD over time, veterans. Some of the medications used to treat PTSD, like SSRIs or maybe other antidepressants, can also trigger or worsen GERD as a side effect. In a 2013 study, over 1,100 Iraq and Afghanistan veterans found that those who screened positive for PTSD or depression were significantly more likely to report gastrointestinal or GI symptoms, including GERD. In fact, over 70% of veterans with GI issues also screened positive for PTSD, showing a strong connection between mental health conditions and digestive problems. If your GERD began after developing PTSD or starting related medications for your PTSD, you may qualify for VA disability benefits for GERD secondary to PTSD. Okay. Again, that GERD secondary to PTSD, the VA rates GERD under diagnostic code 7206 with potential ratings of 0, 10, 30, 50, or 80. Your rating for GERD secondary to PTSD depends on how severe your symptoms are and what kind of treatment you need, such as dilation, medication, maybe you even need surgery, and documented medical findings. Okay. So if you're having problems with your GERD, complain about it, get treatment. The VA looks at whether you have trouble swallowing, need regular esophageal dilations, if you take daily medications to control your symptoms, or have issues like weight or aspiration from severe reflux. So, very important. Okay. That diagnostic code is 7206, gastroesophageal reflux disease. And it could be, again, 0, 10, 30, 50, or 80%. Right. That highest rating is very difficult to get. I've never personally seen anyone with an 80% GERD rating. I'm sure there's some people out there, but I personally haven't laid my eyes on that. That means you would have to have a documented history of recurrent or refractory esophageal strictures causing dysphagia with at least one of the symptoms present: aspiration, undernutrition, and or substantial weight loss as defined by 38 Code of Federal Regulations 4.112 alpha, and treatment with either surgical correction or esophageal stricture or percutaneous esophago-gastrointestinal tube. So basically, you would need to have a PEG tube. That is what you would need to have for an 80% rating. Most ratings I see are 0, 10, maybe a 30. Um, that 30% rating would require dilation no more than 2 times per year. And you need to have a documented history of recurrent esophageal strictures causing dysphagia. Again, which requires dilation no more than 2 times per year. Okay. And then 0% rating is documented history without daily symptoms or requirement for daily medications. 10% is basically you're taking medications and you have a documented history of esophageal strictures that require daily medications to control the dysphagia, otherwise asymptomatic. Okay. Findings must be documented by barium swallow, computerized tomography, or esophagogastroduodenoscopy. Okay. That's a big word. I can't even say that thing right. But non-gastrointestinal complications of procedures should be rated under the appropriate system as well. So very, very important to understand that. So let's talk about proving service connection for secondary conditions. Okay. Again, to establish service connection, veterans, you need 2 key elements: a current diagnosis, a medical nexus as well. Right. And I'm going to throw 3 things in there. Make sure you're getting treatment for your GERD. You need evidence showing that your GERD was caused or aggravated by your service connected PTSD. That's the link. That's the nexus. That a nexus is not just it's at least as likely as not, or more likely than not, in fact, highly probable. It is medical and scientific research that is provable. It is cited sources by a doctor, by a qualifying doctor or medical professional, board certified medical professional that can write a proper nexus letter. And I advise filling out a disability benefits questionnaire as well. But that nexus letter needs to be on the money. Okay. The cited sources, the research, they need to be on money, veterans. Okay. It needs to be on point. Okay. So you can file your claim online, va.gov, by mail, fax, 844-531-7818, or in person at a VA regional office. Right. If you don't file online, you must download and complete VA form 21526EZ to submit your claim. Okay. A strong nexus letter with a high probative value can make or break your secondary claim. Also, golden nugget, a strong personal statement is very important. This letter, this nexus letter, is a formal opinion from a qualified healthcare provider linking your GERD directly to your service-connected PTSD. The nexus letter provides the medical nexus evidence. The VA requires to show that your GERD is at least as likely as not caused or worsened by your PTSD. Right? It should explain the medical reasoning behind the connection, reference your symptoms and medical history, and detail how your PTSD or its treatments like SSRIs contribute to your GERD. Very, very important. Okay. If you're trying to get a high quality nexus letter, reach out to us. We are totally here for you guys, gals. We appreciate your service. Okay. Another thing, while building your evidence, get your diagnosis in writing. Go see your VA doctor or a private gastroenterologist and make sure your GERD is officially noted in your records. You know, gather your PTSD treatment records. The more evidence showing ongoing stress, sleep issues, anxiety, or trauma triggers, the better. And pay attention to your medications, because some PTSD meds can actually worsen your GERD. Get a nexus letter from a qualified medical provider. I already told you, reach out to us, info@Veterans Claim Servants. If you click on the link in our description of this video, if you look at it in there, right, if you're just joining and you go on YouTube and you look at that link and you reach out to those doctors, that's fine, but you're going to be on a waiting list because it's just ridiculous how backed up some of these doctors are. Reach out to us directly, 904-605-0431. Many of you already have. Many veterans who've reached out that have seen this channel, we're proud to say they're at 100%. They've gotten their ratings, and we are honored to help and to serve you. We're going to be fair. We're going to match or beat anybody. You're not a dollar figure to us. We are. I am a veteran serving veterans, ready to pay it forward, continuing to move forward. We are fair to your situation. So just whatever you have going on, reach out if you need something, okay? But get a nexus letter from a qualified medical provider. That is a key piece. A strong medical opinion connects the dots between your PTSD and GERD in clear, simple language, and it has very powerful medical scientific literature, so research and cited sources, okay? Write a personal statement. Tell your story. Describe how your PTSD flares cause heartburn or reflux veterans. Explain how stress affects your digestion, your sleep, in your daily life. Make it personal. Be real and specific. Let the VA know how you're impacted occupationally and socially, okay? Let me talk about some common mistakes veterans make, okay? First, don't just say my PTSD caused my GERD without medical evidence. Don't do that. The VA won't accept that alone. Don't rely on internet printouts. The VA needs documentation that applies to you personally. Don't skip your CMP exam. If they schedule one, show up, whether you like it or not. Be honest. Explain your symptoms clearly and describe how your GERD ties into your PTSD. And remember, even if your GERD existed before PTSD, if your PTSD made it worse, that still qualifies as aggravation under VA law. Make sure whoever's writing your nexus letter clearly states aggravation according to VA law, okay, and how the PTSD made it worse, okay? And a huge tip here, gold nugget, medications matter. If you're on PTSD medications that have acid-related side effects, that's another way to prove service connection. Many antidepressants or anxiety meds can irritate the stomach or slow digestion, which directly contributes to GERD. If your doctor confirms that your prescribed meds are making your GERD worse, that's strong nexus evidence, okay? Very, very important. Let me give you an example of what a solid nexus letter might sound like, okay? I'm going to actually throw that in the link of this video, okay? I'm going to give that to you, all right? There it is. That is a strong nexus statement, okay? You can see it right there, right? It basically says, after reviewing the veteran's medical history, it is my medical opinion that the veteran's diagnosed GERD is at least as likely as not 50% or greater probability caused or aggravated by their service-connected PTSD, chronic anxiety, and hyperarousal related to PTSD, which have led to increased acid production and esophageal irritation consistent with GERD symptoms. Okay. However, your nexus letter needs to have clear medical scientific literature backing things up. Very, very important to understand that. Okay. So listen, veterans, if you're dealing with constant burning, reflux, or sleepless nights because of acid buildup, you don't have to just live with it. You served, you sacrificed, you earned these benefits. Don't back down. Document everything. Get that nexus letter. Fight smart. Remember, just because it's a secondary claim doesn't mean it's of secondary importance. Every connected condition counts for your rating and your quality of life. So that's what I got today here, where we just want to make sure that we help you uncover the truth, strengthen your claim, right, and help you to walk boldly in a successful victory. Okay. If this episode helped you, share it with a fellow vet who might be dealing with the same issue or GERD issue, or might need a secondary service connection to get them to 100% or to the rating that they deserve, right? Follow us, subscribe, check out our other episodes on secondary claims, CMP exams, VA rating strategies, etc. Until next time, stay ready, stay resilient, and as always, keep serving strong. We appreciate your service to our country. Thank you guys and gals for tuning in. Share this out with someone that can use this information. Till next time, I'm out. Peace.